It's been an interesting time to put this exhibit together, because I think during the course of doing the research and putting the material together for the exhibit, I think that I've experienced just about every facet of the wheel of life, from death, from friends, to coping with friends and family who you find out are immobile and how to deal with that. Getting new doctors yourself and all of a sudden going off for every test known to humandom, and yeah, we learned quite a bit. Before the mysteries of the human body were understood, different cultures offered a variety of ways to deal with physical and spiritual pain. For Aboriginal cultures, trained healers understood that the healing powers of plants and a healthy spiritual life were essential for navigating the stages of life. Chinese doctors sought to create harmony in the body through the use of herbal medicines, acupuncture, massage, exercise, and dietary therapy. Western medicine has its roots in science, using conventional medical treatment that includes surgery, chemotherapy, radiation, and physical therapy. Today, it is not unusual to pick and choose treatments that combine elements of many cultures. Chilliwack did not have a full-time medical practitioner until the end of the 1880s. Before this date, Mary Ann Kipp, wife of Isaac Kipp, provided some care, particularly as a midwife. Prior to arriving in Chilliwack in 1866, she spent time with a doctor at her Ontario home, learning the basics of medical practice. Dr. Donald MacLean, an American Civil War doctor who moved north to the gold rush town of Yale during the construction of the Canadian Pacific Railway, arrived in Chilliwack in 1883, but his stay was short. He relocated to New Westminster, where he passed away in 1893. Dr. James Cotter Henderson, the University of Glasgow-trained physician, is acknowledged to be Chilliwack's first full-time doctor. He arrived in 1887, practicing medicine until about 1925, when his son, Dr. Ewart Henderson, took over his practice. Next to join Dr. Henderson was Dr. Robert McCaffrey, who arrived in 1904. In his early years, McCaffrey traveled by horse and buggy, canoe and boat, to reach his patients in Hope, Harrison Mills, Abbotsford, and Red Mountain Mine in the Chilliwack River Valley. Except for a stint in the Royal Army Medical Corps, where he was stationed in Salonika during the First World War, he remained in Chilliwack until his death at 86 in 1960.
Then here in Chilliwack, when I came, there were no specialists. It was all general practitioners. And some had to go away and take some extra courses in order to learn how to do some particular surgical procedure. I know one of the doctors used to go to the Cook County Hospital in Chicago for a month or so and learn some things and come back and be able to do them. Because things happen to people no matter where they live. And nowadays we would have had the benefit of a specialist to solve the problem, but in those days the GP often had to. It was a 2.5-hour drive really into the city. Actually, the first specialist was really Dr. Nick Wishlow. He came before Dr. Phelps when he was the ear, nose, throat specialist. That was the first specialist we had here, I think.
Chilliwack had just a supremely collegial group. It was different from every other community in the valley. Maple Ridge, Mission, Abbotsford, Langley. Was not a happy place as a doctor, but Chilliwack was absolutely collegial. And I'd like to suggest that the credit of that went to a Dr. George Gibbs. He was a general practitioner, and he started a clinic here, the Mary Street Clinic. He and Dr. Whedon. George Gibson had been here for quite some time, same as Dr. Wolford. And he was the catalyst to produce a very, very pleasant atmosphere in this community, medically.
The first fundraising event for the hospital was a minstrel show that was held at the Opera House in March 1908, which was organized by Carl Grossman, who's my great-grandfather, and some other young businessmen in town. It was held a few days before Carl's mother, Julia, and sister Elva arrived from Hamilton. And the family story is that my second great-grandmother, Julia, only agreed to move to Chilliwack if there was the promise of a hospital, because she came from Hamilton, where they had a number of hospitals, and she obviously thought Chilliwack was a little backwater, and she wasn't coming without. So that's the family story there. So he got his stuff together a few days before Mom arrived and did the minstrel show, which was the start of the fundraising for the hospital. The women continued to fundraise. They made pillows, they made the hospital linens, they made the gowns the patients wore, they canned fruits, they baked bread, they even had chickens and the egg went to the hospital pantry. They did the gardening, they planted trees. I mean, they really supported the hospital. They sold tags that you could wear on your jacket, and they stood in the 80s. They stood on the street corner with this box and they sold tags. It ended in 1986 because it just wasn't as comfortable standing on a street corner selling things.
The Methodist-run Coquillet's Industrial Institute opened in 1894. Of its features, the Isolation Hospital and the 1915 Aboriginal Tuberculosis Center are not well known. In 1918, during the global influenza epidemic, the Institute was temporarily converted into a hospital with 101 patients lining the dormitories, hallways, sitting rooms, and the large recreational hall. In 1924, a larger structure, Coquillet's Residential School, was built, which in 1941 was converted into a tuberculosis hospital. A new wing was opened in 1955. Prior to the hospital, a preventorium was opened on the grounds in 1935. Its residents were selected after several physical examinations that determined which Aboriginal children were the most susceptible to tuberculosis. Apart from the treatment of tuberculosis, the facility's staff of doctors and nurses included an eye specialist, dentist, and arthritis specialist. Former patients returned for checkups, and some participated in a cancer survey. Local First Nations children convalesced at Coquillet's after receiving specialized care in Vancouver. Chest surgeries were performed in the facility's operating room by a specialist who made weekly trips from Vancouver. After affiliating with the Vancouver Vocational Institute, student nurses spent 1 month training in Coquillet's children's wards. In 1969, the hospital was closed. In the 18th and 19th century, diphtheria, smallpox, diabetes, tuberculosis, polio, pertussis, or whooping cough, and other serious illnesses still plagued the world. In response, medical practitioners and charlatans developed products that offered hope to seriously ill people. Popular during this time were treatments such as Thompsonianism, purging and sweating, phrenology, studying the cranium, mesmerism, using magnets to manipulate magnetic fields around the body, electrotherapy, to balance positive and negative areas of the body, and hydrotherapy, use of cold clothes applied to affected areas. None of these treatments were effective, though, against the devastating effects of viral and bacterial infections. One of the reasons that we chose to do a history of medicine in Chilliwack is because we had strength in objects. We had received a huge collection of material from the former Mary Street Clinic after it had relocated, and there was loads to work with. We had received other materials from other local doctors. We had some dental material. Because, museums are about things, and when you put the things out on display, and knowing that medical things in particular create huge curiosity amongst visitors, that this was an opportunity to work with a lot of material that we have that would never get exhibited.